My name is Dr. Hillel Mazansky, specializing in medical hypnotherapy, guided visualization, nutrition, and exercise. Today I'm going to discuss a condition that is very near and dear to females' hearts. I wouldn't say dear, but is something that females often think about, and that is breast cancer. Breast cancer is the most diagnosed cancer in American females today. It is the most prevalent cancer that females get today. There is much to discuss, but I will rather reserve my discussion to those salient points that are necessary. Breast cancer has a genetic preponderance. In other words, if a mother or an aunt has breast cancer, the greater chance is that one of the females in any generation, especially the second or third, will develop, or first, will develop breast cancer. There is a test that one can do to check for breast cancer, and it's a genetic test. Very few people undergo this test unless there is a family history of breast cancer. Insurance companies, if they had to find out that you, the patient, was positive, it could affect your insurance. However, that should not be a great concern because your health is primary. Breast cancer usually begins as a small lump in each or other of the breasts. And as the cancer develops, the swelling or the tumor gets larger and larger. However, with mammography today, we are able to determine a small breast cancer before the patient or the doctor is even able to feel for that cancer. There are certain genes that are checked, as I said, and that's the HER2 positive gene. And also, when the tumor is graded, it is graded from stage 1 to stage 4. 4 obviously is the worst, as that means it has metastasized over the whole body. Stage 1 is if it's localized to the breast, and so on. If the HER2 is positive, if the estrogen receptor is positive and the progesterone receptor positive, certain hormonal treatments are given to the treatment. Now, when a diagnosis of breast cancer is given to a female, this causes great shock, and it not only affects her, but of course it affects her family. The patients generally think this is the end and they're going to die, but this is not so. If you are a stage 1 or 2 localized to the breast, your chances with good treatment, you can survive. We also know that the various therapies that are given can be surgery, radiation, chemotherapy, hormone therapy, and alternative therapies. And that's where we come in. As a holistic physician, we empower breast cancer sufferers and survivors to assist themselves in their own treatment or healing. Because females with breast cancer feel often lost. They are treated by a surgeon, by a radiologist, by a chemotherapist, and they are bewildered. How about if you, the breast cancer sufferer or survivor, empower yourself to help treat yourself? And you can do that by medical hypnosis, guided visualization, nutrition, and exercise. We know for a fact that if you have a powerful nutrition program consisting of a lot of fruits and vegetables with dark colors indicating high antioxidant content, and exercising, you will help heal yourself. You will help heal or treat yourself using hypnosis. And I have seen patients who have had stage 4 cancer, and when they've started our program of hypnosis, nutrition, and exercise, they have slowly returned to a 3 and then to a 2 and a 1. And this is quite amazing. Yes, the chemotherapy and the surgery helps. I do not deny. You should listen to what your physician offers you for treatment and take it. But there is a treatment that you can help treat yourself with, and you will feel better using the hypnosis video twice a day. Also, to help prevent breast cancer, we suggest that you take 5,000 units of vitamin D3 every day after meals, and then go and get your blood level taken after 2 months. If it's at the level of 45 or more, that's fine. If it's not 45 or more, then we suggest you increase the vitamin D dosage. But that's up to your physicians to decide. The next is drink 4 or 5 cups of green tea a day. Research has proven that in the Japanese, they never get breast cancer or prostate cancer, not because they eat soy, but because they drink green tea. 2 heaping tablespoons of organic ground flax seeds, and that combination daily will certainly help you treat yourself and also might even help prevent breast cancer from developing in the first place. Why does breast cancer develop? There's one word: stress. Stress causes all our physical and psychological illnesses. You can take 2 identical twins or 2 daughters. Both have the cancer gene. Why does one daughter develop it and the other not? Because the one that develops it, when we ask them and delve into their subconscious with hypnosis, they suffer a great deal of stress. Stress decreases your immunity. And when you get rid of stress, your immunity increases. When your immunity is decreased, of course, then you can develop breast cancer and all other diseases. But if your immune system is high, you don't develop disease or cancer in this case. Other things that cancer patients can do is, besides eating a highly nutritious diet and exercising, for them to socialize with their friends. Be among friends that you don't think about your cancer all the time. Laughter therapy is extremely beneficial, and this was described by Cousins in the 1980s. So we suggest that you should watch comedies on TV and at the movies, because when you laugh, you secrete the endorphins or the feel-good hormones, which help treat your breast cancer. This individual, Cousins, had metastatic cancer over the whole body, and he decided not to take any treatment at all. All he did was laugh a great deal. by reading funny books, etc., TV and movies, etc. At the end, when it came to recheck him, he cured his cancer himself just through laughter therapy. I'm not suggesting that that's all you should do. What I do suggest is that you should use that as a tool to treat your breast cancer. We also know that the earlier a girl starts menstruating, the greater chance she has of developing breast cancer. And what has actually taken place here is there a substance called a xenoestrogen, or a false estrogen, which comes in a lot of pesticides. And these false estrogens act as if they were actual estrogens. So one sees today females of 10 or 11 with developed breasts going through early puberty, and they are at greater risk to develop breast cancer than the ones who don't. We also know if a female nurses her child, she has less of a chance of developing breast cancer in comparison to those who use formula. There's a whole lot more to say, but I want to keep it brief. To visit our cancer hypnosis video, please go to drmedicalhypnosis.com and purchase the cancer video, which includes nutrition and exercise. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.